This is the Hemophilia Council of California's webinar, Virtually Making Your Voice Heard, and I am Lynne Kinst, the Executive Director of the Hemophilia Council of California. And we want to thank you so much for joining us today. This is the first time which we have had to do our advocacy days as a virtual event. And this is new to all of us, but it's more important than ever that we work on making our voices heard and work to fight for access to treatment and access to insurance and important things to be able to continue to treat bleeding disorders and other rare and chronic conditions in the state of California. So we thank you guys for joining us today. So we have right now around 60 people who are signed up for our virtual advocacy day. And we have a total of a little over 30 meetings that those 60 people are having with legislators from our state and legislative staff. And so that's exciting. Despite the fact of everything that's going on, we still have quite a few people who are going to be participating, and we have quite a few offices that we're going to be connecting with even during this COVID-19 time period. And I also want to mention that even if you are not part of that group, if you didn't register in advance and sign up to be on one of those teams of people, you can participate with us tomorrow by reaching out to your legislators via email, through social media. And we do have a toolkit on our website with all of those resources, with sample emails, with the link of how to find your legislator, with our social media toolkit with graphics. All of that is online in our virtual advocacy toolkit. So you can get that on our webpage. If you have any trouble accessing it, my email is going to be at the end, and you can reach out to me via phone or email, and we can help you to access that. So the four main talking points for tomorrow, whether you're doing this in in-person meetings or whether I should say virtual meetings, or via social media, is we are focusing on maintaining eligibility and benefits of the California Children's Services, also known as CCS, and Genetically Handicapped Persons Program, or GHPP. As we mentioned a little bit ago, there was the question about the funding for GHPP and CCS. Currently, those are fully funded in the budget, thankfully. So we are going to be focusing on thanking legislators for maintaining that funding. And Terry's going to talk a little bit more about that and the specifics of that in just a moment. The second talking point is going to be ensuring continued access to factor and other necessary medications and ancillary medical supplies when the new Calrx program is established in January. So we're also going to talk a little bit more and dive a little deeper into what that Calrx program is about. One of the silver linings, you might say, of the COVID-19 situation is that the state has expanded telehealth opportunities for patients during this time period, and has adjusted and in some cases increased reimbursement for providers, which makes it more practical for them to be able to provide healthcare via telehealth. And so we would like to encourage the state to continue to maintain that flexibility for patients for telehealth. And those of you who have been able to receive your care via telehealth and have found that to be beneficial, this would be a great opportunity to say thank you. And as Caitlin talked about, to share your story of why that was beneficial. In some parts of our state, people have to drive very far in order to access treatment. They may live in rural areas. It may be difficult for them to get there. Or conversely, you might live in LA and maybe the miles aren't far, but the traffic is horrendous. Or you might have transportation challenges. You may not have a car, and you might have to take, buses that take forever to get there. So there are lots of reasons why telehealth could be incredibly beneficial for somebody to be able to access their providers that way. So that is that is a change that COVID-19 has brought about that we want to continue to say thank you for and promote, because we would like to see telehealth stick around after we hope that the pandemic passes. And then the fourth issue that we're going to talk about is the Copay Accumulator Adjuster programs. This has to do with insurance. It mostly affects people who are on private insurance plans, and it is when insurance companies have implemented programs where they essentially no longer accept the co-payment support programs in payment against the patient's deductible. And we are still investigating a recent federal ruling on this issue and how it's impacting our California patients. But we have also signed on to a letter urging state officials to take action to prohibit copay accumulator adjuster programs within the covered California program. And so that is something that I think we're going to be doing a lot more advocacy on next year, because currently there is not a bill in the legislative cycle on this introduced yet, but we want to go ahead and mention that that is a concern for our community and kind of pre-advocate towards getting that bill introduced next year. So with that, I'm going to ask Terri to give a little bit more information on GHPP and CCS.
Great, thank you, Lynn. So you did a great job of covering our 4 issue points. And so I'll go into a little bit more in depth on those items. And then Lynn, you can join me in wrapping it up. I want to say though, that there really are 3 things that our future leaders are going to be doing tomorrow. One is telling their story, and they've had a lot of time to practice this, and I'm really impressed by their enthusiasm in telling their own personal story of how bleeding disorders either impacts them directly or impacts one of their family members. So 1 is telling their story, 2 is saying thank you. 3 of the items that we have on our legislative agenda are really thank yous to the legislators and staff for protecting us in this COVID pandemic and in the state budget. So telling the story is 1, 2 is thanking the legislators and staff, and then 3 is sort of giving them a heads up that we will be coming back to you in the future if the budget situation gets more challenging, if we're not able to secure sufficient federal dollars or tax returns to make the budget deal come together. So again, it's telling the story, saying thank you, and giving them a heads up into the future. The programs that really benefit our community are indeed protected in the state budget, and those programs are CCS and GHPP. California is very unique in that we have these 2 medical programs that provide care to our population that has hemophilia, von Willebrand disease, and other related bleeding disorders. So we get our medical care through these programs, and our community gets their factor and other ancillary drugs and medical supplies through these programs. CCS, California Children's Services, is for the infants all the way up to age 21 if they have a rare bleeding disorder and other rare conditions. It's GHPP, or Genetically Handicapped Persons Program, for those 21 and over if they have hemophilia and other rare conditions. And I guess I should back up and say that we're thanking the legislators tomorrow and the staff for protecting both CCS and GHPP in the state budget. They will be voting in the budget committee tomorrow on Wednesday, and they will be voting on the floors of the Senate and Assembly on the final budget deal by Friday. So we're thanking them for protecting CCS and GHPP in the state budget. The governor also has a new program called Calrx, and he has scored $178 million in savings for this program. It's a large, comprehensive, complex drug purchasing program, as well as drug management program. And our little piece is basically asking the legislators to continue to monitor the Calrx program when it goes into effect January 1 of 2021. We're being told by the state that they have policies in place to continue to protect our community and to ensure that they will get their factor and other ancillary supplies as well as other drugs in a timely fashion like they do today. But because they will be using a new fiscal intermediary called Magellan Medicaid, we want to make sure that the state policy leaders will still be involved. And they tell us that they will. So this is more of a heads up to legislators to say, hey, when the governor puts forth this new Calrx, January 1st, 2021, we want to make sure that our community can maintain direct, timely access to their factor and related medical supplies and other drugs. So it's really kind of a heads up. We need them to help us monitor this going forward. And then telehealth, as Lynn mentioned previously, during the COVID-19 pandemic, our community and others have been given a fabulous opportunity to be able to see their physicians and their medical care team at their hemophilia treatment center or other physician's office or clinic or hospital via telehealth. So they can either talk via phone or video conferencing, and those visits are considered full, comprehensive, medically reimbursed visits in the state of California's eyes. The governor put forth an executive order early on. We had been advocating for that so that we would have that flexibility. Of course, it's best to see your care team in person, but when that's not possible due to COVID-19, telehealth is the next best thing. So again, we're thanking legislators and staff for allowing that flexibility during the pandemic, and that we'd like to see that continue until there's a vaccine. And with that, I'll turn it over to Lynn to talk a little bit again about copayment accumulator adjusters.
So what I'm going to say about copayment accumulator adjusters is that it's a very complicated issue, and we have about 5 minutes left. So your issue sheets that you received give 3 bullet points related to copay accumulator adjusters. The last bullet point states that patients with chronic and rare diseases depend on copayment assistance programs to be able to afford their specialty medications. Copayment accumulator adjustment programs, coupled with the rise of high deductible health plans with deductibles of at least $1,400 for an individual, and coinsurance as high as 50%, makes it difficult, if not impossible, for patients to adhere to their treatment plans. What I would suggest to all of you is that please go ahead and use the talking points on your sheet to let your legislator know that that the council is asking for the legislature to prohibit the copay accumulator adjuster programs. Some of you may have personal experience with these copayment accumulator adjusters. And if you do, that would be the perfect opportunity to share your personal story about that issue. If you don't, and you are not familiar with the issue, feel free to just share the talking point or let another person on your team share that information. And if they have any questions that you can't answer on this or any other topic, the correct thing to do is to never try to make up an answer. We've talked to the future leaders about this. If you aren't sure, just write down their question, and after the meeting is over, one of the members of your team can either email or call myself or Terri, let us know, hey, we were talking to such and such legislative staffer, and they asked a question about this issue, and we weren't sure what the answer was. Can you please follow up with them with that information? And we will be happy to get that information to them. So in the last few minutes that we have remaining, we did just want to go over a couple of quick tips and logistics for all of you who are going to be having your team meetings with legislators and legislative staff tomorrow. I did want to make a quick reminder. We are asking everyone who's participating in legislative meetings tomorrow to make sure that you review and sign the code of conduct. The code of conduct and was sent around in email, and Andrea also posted it in the group chat. So please complete that today. And then also remind everyone that all of the talking points, the issue sheets, graphics that you can use for social media, all of that is online in our toolkit as well. At this point, I do want to open it up for questions for those that may have questions before tomorrow.
And Lynn, this is Terry again. I see in the chat box that there were some comments about telehealth, and I think conceptually we do support telehealth going forward, but specifically for tomorrow, I think we just thank them for allowing telehealth during the pandemic, and we'd like it continued forward without locking into a time frame, because we don't have legislative board approval to go beyond the vaccine. So it's just something we haven't talked about, nor have the future leaders practiced. So while I'm sensitive to some of the comments that came about, I think we have to stick to what we're allowed to speak to so far per our normal legislative process with our board.
Thanks for that, Terry. And then there was also a comment or question in the chat about what would be appropriate to wear. You know, typically in the Capitol, we definitely would have everyone wear business attire. Obviously, you're kind of going to be on a small screen, so they're not going to see all of you, but it is important. You do want to be professional in your appearance. And we have encouraged future leaders. They did get to practice tying a tie, so they may want to have their red ties with them and on. You know, we had a tongue-in-cheek, I think, comment about, do you have to wear pants? You know, I would definitely wear something on the bottom, but make sure that what is on the screen is professional and not distracting in appearance. So make sure that not only your clothing, but also what is behind you is not a distraction from your meeting.
Hey, this is Mike. One question, is there a good website or something to go on to do a quick overview of who you're meeting with? I know they said it was important to kind of understand. I can Google.
So in the emails that we sent out, you mean like the legislators?
Yeah.
So the emails that I sent out to everybody's teams, the legislator's name should have been a hyperlink to their bio.
Oh. All right.
So if you go back to the original email that I sent to each team that has the meeting times and then the name of the staff person and then the legislator's name, that legislator's name should have been like a blue hyperlink, and that should take you to the legislator's bio. But it's also pretty easy if you see the legislator's name to just Google the legislator's name, and their webpage and their biography should come up.
All right.
And this is Terry again. We actually represent the community, and so we are not partisan in the Capitol. So whether you're meeting with a Democrat, and the Democrats do control the Capitol, with the governor being from the Democratic Party, as with the legislative leadership in both houses, but we are always respectful whether we're meeting with a Democrat, Republican, or an independent. Our issues transcend political parties. So I want to make sure that we don't get into any kind of negative political debates. We don't say anything flippant. We keep everything very professional and very direct to the issues. Again, telling your story is the most impactful part. Thanking them for protecting CCS and GHPP, allowing telemedicine, and then helping us continue to monitor Calrx as it applies to our factor, and helping us to monitor the accumulator adjustment programs and to oppose them if they come forth in 2021.
So we are a couple minutes over, so just a couple quick wrap up points. So question in the chat about if we are wearing red ties or not. Yes, if you have a red tie, wear a red tie. I think that would be a great continuation of our theme to red ties. A red scarf or something like that will work as well if you don't have a red tie. So red ties is fabulous. Secondly, just quick reminders as it relates to a couple of things that were in the email. If you do have future leaders in your group, there are 4 groups of future leaders, and several of them have some additional adults. Please defer to them to let them sort of lead and share their stories, and the adults in the group are there to support and just be supportive of the future leaders telling their stories. And then lastly, just a final reminder, the code of conduct reminds everyone that we're here just to promote the bleeding disorders community and the issues that the council has laid forward. And so no sort of personal agendas or business interests should be promoted during these meetings. Those are things that you can schedule and talk about on your own. And we really appreciate your support and your cooperation in that. So thank you all so much for joining us today. We hope that this was helpful as you prepare for tomorrow's meetings. We hope that those of you who were not able to participate in the meetings will join us in advocating on your social media channels or via email tomorrow. And if you have any questions whatsoever that we didn't get to, my email is at the bottom of the screen. It's lkinst, K-I-N-S-T, at hemophiliaca.org. Please feel free to reach out to me, and we'll be happy to direct you in the right direction. So thank you so much, and we look forward to a great advocacy day tomorrow. Talk to you soon.